Hello, we are going to start the topic Caries activity test. This is very important topic and various MCQs come onto this, and it also helps in our day-to-day clinical aspects. Let us revise what actually the dental caries is. It is an irreversible disease that is progressive in nature with a multifactorial origin, in which the calcified structure of the teeth is started to get demineralized in its inorganic portion, and there is a destruction of the organic portion. Now, caries activity terminology is referring to the increments how the active lesion of this caries over a time frame that we are considering here is progressing. So caries activity is basically the measuring how the progression of the caries lesion is in its speed. Now, the caries susceptibility is referred to the tendency of the host and the targeted tissue where tooth is affected by the process of the caries. This is considered as the susceptibility of the tooth here in this case to the lesion called caries. Okay. Now, caries activity test measure of the degree to which the local environmental challenges are posed off to the probability of occurrence of this carious lesion. It might be microbial growth or metabolism of the microbial pathological flora or the dietary effect like risk factors, right? Purpose of caries activity test is to identify the high risk group individuals. It helps us to decide the personalized preventive measure plans, monitor the effectiveness of the oral health, ensure a low level of the caries activity. This caries activity test allows us to indexify and aims at reducing the load of Streptococcus mutans and Lactobacillus. Ideal requisites of a caries activity test are: number one, it should be valid and reproducible at the same time. Number two, the test should be a good correlation between the caries activity scores and the actual developmental symbolic activity of the caries lesion, which is simple in its nature, and the outcome, the result, is obtained rapidly. That is in hours, within hours. It should have a measurement of mechanism involved in the caries process basically, so that it is applicable to any clinical setting without being an invasive in nature, and it should be less expensive. First, we are going to talk about the activity and the susceptibility tests. Caries activity tests are being classified, as you can see on the scene, in the count method and the evaluation of the virulence. The evaluation of the virulence are being enumerated further as the Nider's colorimetric test, enamel solubility test, caustic calcium dissolution test, salivary reductase test. Count method basically counts out the colonies. For example, Lactobacillus count test, Streptococcus mutans level in the saliva, or the swab test, saliva buffer capacity test, or the Albin's test. First, we are going to understand about the Lactobacillus colony count test. It is basically framed onto the principle where we are estimating the number of the acidogenic and acidiuric microorganisms in the saliva of the patient's mouth. We will culture it on the pepton agar plates, and after inoculation of the sample, we will study the colony count. The selective media favoring the growth of the acidiuric lactobacilli is the basis of the test here in this case. What equipments are being used? Saliva collecting bottles, paraffin, 29 ml of the saline, bent rods, agar plates, cubic counter, and pipettes. What we will do? We will collect the saliva in the chewing paraffin before the breakfast. And once the patient is chewing paraffin, the saliva will be produced, empty stomach, and it will be collected. It should be vigorously shaken. It is diluted, and the undiluted samples are then spread evenly over a rugosa SL agar plate, which is incubated for about 4 days. The number of lactobacilli colonies which are developed are thus counted. Interpretation is on the screen, on to basis of which we will classify it as no activity, slight activity, moderate activity, or the marked activity test. Only disadvantage related to it is an inaccurate in prediction of the onset of the caries. It does not completely exclude the growth of other relative acidic organisms. It is only taking few minutes to do the test, though the result takes several days. Next comes the Nider test, Nider colorimetric test. It measures the ability of the salivary microorganisms to form the organic acids, which are basically from the medium of the carbohydrate. Classical formula of the Nider's agar per liter purified water is on the screen, which you need to remember for your exams, like it contains casein or the pancreatic digestive juice, yeast, dextrose, sodium chloride in some amount, agar and bromostressol green. Medium contains the indicator dye in this test, where this dye is referred to as the bromostressol green, which changes its color when pH drops to 5.4 to 3.8 pH. Once after chewing, the paraffin saliva is collected, the tube of Nider regulus plate is melted and then cooled to temperature 50 degrees centigrade. 0.2 ml of saliva will be split onto the tube and mixed. As soon as the agar is solidified, it will put for the incubation. Amount of the acid produced by acidogenic organism is detected by the changes in the pH drop. And it will be checked with the background of 24 hours, 48 hours, and 72 hours. The rate of the color change from green to yellow is indicator of the degree of the caries activity test, as you can see on the green. Performance from yellow to green on the screen. It is relatively simple, cost-effective, but time-consuming method. So, it was in 1965 where Granger et al. Give us the swab test. In swab test, we are determining the oral flora, ability of the salivary microorganisms to form the organic acids from the carbohydrate medium. In this also, pH drop is taking place from 5.4 to 3.8. Subsequently, this swab, cotton swab, which is taken from a particular tooth surface, like buccal surface of the tooth, is subsequently incubated in the medium. The interpretation of the pH drop helps us to determine the caries activity test. If it's post drop below 4.51 pH, then it's marked caries activity in this case. Streptococcus mutans levels in saliva. It will measure the number of Streptococcus mutant colonies, which are formed units per unit volume of the saliva in respect to the saliva and the plaque samples from discrete size. It will include like proximal areas, occlusal fissures. Incubation is done on the Mithas salvarius agar. It is a selective Streptococcus medium. With that has an addition of high concentration of the sucrose and 0.2 unit bacitracin. Bacitracin is suppress the growth of the most non-mutants colonies. So it is very selective in nature. Sample collection by the use of the tongue blades is done. Incubation for 48 hours at 37 degrees centigrade is done at the gas mixture enriched with carbon dioxide about the 95.5% percentages. Now, interpretations of the level of the mutants is 10 raised to power 5 per ml. Saliva is acceptable. Streptococcus mutant screening test will be also referred to as the plaque toothpick method. It is a simple screening method in which dilution of the plaque sample on the streak on a selective culture media is done. Sterile toothpicks, sterile ringer solutions, platinum loops, and Mithas salvarius agar plates are used, which contain sulfadimethyne. Plaque samples are collected from the gingival